Hey guys, welcome to the First Principles of Medicine podcast. In this series, we will be breaking down complex medical topics into their first principles. When the stress is on and you've just been asked a difficult question that you don't know the answer to, we feel that you'll be able to fall back on these first principles to formulate a decent answer and reason your way out of trouble.
Hey 1PM listeners, we're really glad to be working with Oscer to give everyone free Oscer Prime upgrades. Oscer is a AI chatbot that you can practice your histories with. Just use the 1PM sign-up code in the show notes below. Thanks everyone.
Good afternoon everyone, welcome to another episode where JT is going to be taking Adian, Jason and myself through urinary tract infections. Take it away JT.
Thank you Dan. Welcome everyone to the 10th episode of 1PM. It's a big achievement for us, and if you've been tuning in this whole time, we thank you for listening. First of all, whenever I run an episode, I like some trivia. So, trivia. Going back to some zero principles, because this is not the first principle. First of all, Jason, what do you know about a sterile site, and what is it?
So
or you can give me some
sterile
examples
site
of sterile sites.
from the 10,000 modules I've had to do on aseptic technique is defined as a site where there are no bacteria or very few bacteria.
Mm-hmm.
It's a clean area.
It's a clean area. Good. So it doesn't have to be just bacteria, just microorganisms or any just pathogens.
Yeah.
Right. So Dan, can you give me some examples of sterile sites in our body?
Well, the upper urinary tract, in the peritoneal cavity, in the thoracic cavity.
Yeah, there's plenty of spaces that should be sterile. And as you mentioned, and is relevant to this episode, is that in a healthy renal system, the upper urinary tract. So now, the first principles of UTIs, we'll talk about two things. The first is we'll talk about the structure of the urinary tract. And the second thing we'll talk about, it's like a battle between the defense mechanisms of the urinary tract against the infection mechanisms of the bacteria. So that's what we're going to break it down to. So, Adian, sitting there, why don't you tell me about the structure of the urinary tract? What is the pathway of the urine after it is filtered from the kidney?
So the enterograde pathway
Interrograde. Ooh, big words.
goes from the kidney via the ureter
Lovely.
into the bladder,
Yes.
and then is excreted via the urethra.
Nice. Nice.
Sorted.
That's very good.
I can go home now.
Good. Pretty much. So, using that, if these organs are affected, the pain would be radiating somewhere in the abdominal regions. So, Jason, if the kidneys get affected somehow, where would you locate this on the abdominal region? What do we usually call that word?
So if the kidneys are affected,
Yeah.
is it like the renal angle?
There is a renal angle, but broadly speaking, Dan,
Flank.
the flank. Yeah, we're talking about the flanks. Yeah.
So like the sides of
The
that
side,
kidney.
yeah, the side. And usually a little bit up rather than down.
Yeah.
Okay.
You use the anatomical terminology.
I was going to use it and then I forgot.
You forgot.
Superior? Superior and inferior. Okay.
A little bit up.
Dan?
Are you talking about the radiation?
No, just where the, like,
Oh, the
in
okay,
reference
yeah,
to the
yeah.
umbilicus. Yeah. So talking about the ureters now, where would you find this, roughly speaking?
Well, the ureters are quite long. I would say it could be flank, it could wrap around to the lower quadrants, the abdomen.
Yeah, good.
And potentially radiate down towards, or medially.
The groin or even?
Yeah.
Yeah, good. And the word they sometimes use is called the uretopelvic junction. And then, Adian, we were talking about the bladder. So it goes into the bladder. Where do you usually find the bladder?
It would be the suprapubic region.
Suprapubic region,
believe.
yeah. So these are very important and they will be relevant for our clinical features later. Now, within this urinary tract, the arbitrary designation of an upper tract and a lower tract is divided roughly at the ureters. So anything above the ureter is considered a upper tract infection. Anything below the ureter is considered a lower tract infection.
What about the ureter itself?
Yeah, I was going to say.
I don't know where
Greater
exactly it
than
cuts
or
off the
equal to?
ureter.
As in, like, is the junction where the ureter meets the bladder or where the ureter meets the kidney?
Roughly where the ureter meets the bladder.
Yeah, okay,
Yeah,
gotcha.
roughly. But this is just one way to classify. So going back to the terminology, what's the suffix that you usually use if it's inflammation?
Itis.
Itis. So using your example, if the bladder was affected, what is that called?
I know it's not called bladderitis.
Yeah. So using your Latin
trick question there.
terminology,
It's called cystitis.
cystitis. Lovely. And then going up from the bladder, you get the ureter. Where do you get, Dan?
Uretitis.
Lovely. Moving up, you get the kidneys.
Nephritis.
Yeah, pyelonephritis. I actually
yeah.
don't know. Yeah, this is something I don't
Yeah.
understand
Yeah.
as well. It's why is it like, if it's a nephrologist
Yeah.
that only focuses on the nephron, right? And why is it not called a rhenologist?
I think you've cracked the system there, JD.
Broken it.
Fucking
Come
hell.
on, let's go.
Cool. So we've talked about the structure of the urinary tract. Now, because of a UTI, there's usually an infection that happens from a bacteria. So if we want to go think about this urinary tract, what are some defense mechanisms that we have to fight off these bacteria?
So we've got the urine itself, which
urine
has a low pH, so
Low
it's
pH.
acidic.
Acidic,
and
yeah.
Acidic stuff tends to kill bacteria.
Yeah, good. Rightly said. Anything else, Dan, that's
Yeah.
related to the urine, actually?
Yeah, so also with the urine is it flows
Mhm.
through the urinary tract, that it has a flow effect, so it
Yeah,
can wash
good.
away.
And it
bacteria.
prevents what? Prevents
Prevents, I don't know, bacterial aggregation.
Colonization.
aggregation or stasis causing aggregation and then
Yeah.
causing colonization. Yeah, so you want this continuous flow.
Yeah.
Good. There's actually something else within the urinary tract. That's not the urine.
Of course, it's me, isn't it? Like these two. Urine. I've got what else? I'm sorry. Could you repeat the question, please?
There's something else other than the urine. And you
contributes
might be... Huh?
As a defense mechanism.
Yeah, yeah. It might be easier to think of in females. They probably have... It's more
I do
salient.
believe it is. Is it mucus?
Mucus, yeah.
Mucus,
Yeah,
yeah,
good.
yeah.
And that mucus lining within the urinary tract,
Yeah.
what do you think that does? Why is it a defense mechanism? Why do we...
Traps the old bad bugs. Does it? In the mucus?
Yeah, kind of like in our
lungs?
our nose, our respiratory tract when we like try to cough it up.
Yeah.
It's this lining along this ureters, urethras makes it more difficult for the bacteria to penetrate into the system itself.
So essentially, we've got the acidity of the urine,
Mm-hmm.
the mucosal lining of the urethra,
Good.
and the flushing mechanism.
The flushing mechanism. Yeah.
So those three help.
I think these are the three key mechanisms that I want to focus on. There's some other things as well, obviously, and you can check the notion for that. So imagine you have on one side, you have all these three defense mechanisms that you have. Now on the other side, what's something that the bacteria has to target these defense mechanisms? What's something that can counter the mucosal lining that the bacteria has? Thinks back to like high school biology.
Yeah.
You're drawing the typical prokaryotes.
Is it like the encapsulation of the bacteria?
Like the capsule?
Yeah, the capsule.
What do you think that can do, though, to our defense mechanism?
Protect it from the acidic environment,
Yeah.
protect it from anything in the mucus that might otherwise attack the bacteria.
Yeah, that's one thing. But I want to think further. So imagine Incy spider climbs up
It's
the
got
water
legs.
spout, right?
Must
Yeah,
have
the
got
fimbriae.
legs.
Yeah.
Yeah, so it has to. It's not just. It can't just live in that urine because it'll just get flushed out, right? So what does it need? What did you say?
Fimbriae
Fimbriae, and what does that do?
allows it to be mobile. Motility and attach.
Yeah,
onto
yeah.
the
So you want to
mucosa
attach to the urinary tract, so then it can climb up. Yeah.
So fimbriae. Yeah. What else?
There's actually one
Really?
thing too that helps to reduce the urine flow. It inhibits peristalsis of the urinary tract. That's something that bacteria produces.
It's like a toxin.
Yeah, toxins. They help to inhibit this peristalsis movement, so it causes the urinary stasis, which then allows this bacteria, spider, to just climb up.
Not bad.
Think of that analogy.
Yeah.
And then finally, it's more like a counter for the mucosal lining. So the mucosal lining makes it difficult for them to live. Sometimes the bacteria produces something as well, like this biofilm that they create around it. So, yeah, so I hope I've drawn this picture for you. There's defense mechanisms that we have, and then we have these attack mechanisms that we have in the bacteria.
Yeah.
And this is essentially how it's a four-step process, I guess we can say. First, the bacteria has to colonize the urinary tract, then has to climb up. Then when it climbs up, it can penetrate the epithelium lining of the urinary tract, and then it begins to replicate. And then that's where we get the infection, then inflammation, and then downstream you get sepsis and whatever. It can affect anywhere along this urinary tract, as we talked about earlier. And roughly speaking, the higher it goes, the more severe the clinical features are.
Yeah.
Gotcha.
Does that make sense?
Yeah, it does.
Yeah.
Yeah, so that's essentially the two first principles that I wanted to talk about today. And then from there, we can talk about the clinical features and other things.
Gotcha.
Sweet.
Brilliant.
I guess this goes on to the next part where we want to classify UTIs. So one thing that we can classify is by the location, as we talked earlier. The lower and upper. So this is based on the anatomical area. But another way to classify it is by the clinical severity. So there's three broad categories here. I wonder if you guys know them. Sometimes you can get UTIs, but you can have no signs or symptoms about it. Dan?
Asymptomatic.
Yeah, so it's called asymptomatic bacteriuria. So there is bacteria in your urine on the urinalysis, but you're asymptomatic.
Gotcha.
Typically, you don't really have to do much about this. Moving on, we have 2 more categories.
The complicated and uncomplicated.
Complicated, and therefore you must also have
Uncomplicated.
uncomplicated. And then, do you know a little distinction here? Why is one uncomplicated?
Is an uncomplicated one where there's only one bacteria which is growing within the urine, whereas a complicated one is when you've got multiple species.
Try again. Right, okay. So here, it relates to the demographic. What demographic usually
complicated is pregnant women and men.
Sure.
And then uncomplicated is usually healthy premenopausal women.
You got most of it, yeah. And so uncomplicated is usually they're healthy, they're non-pregnant, and they're premenopausal. So these are the typical demographic that gets UTIs. And then complicated is essentially everyone else. All these other risk factors that have more treatment failure or serious outcomes.
So general male UTI is considered a complicated UTI.
I think so, yeah. Because typically males don't get UTIs as often.
If you're just such complicated.
And so what actually makes up 70 to 80% of complicated UTIs? This is one big risk factor that we usually see in the hospital after surgery, and there's something hanging out of there. Yes, good. So indwelling catheters make up 70 to 80% of complicated UTIs. And so that's the biggest 3 categories: asymptomatic, uncomplicated, and complicated.
Sweet.
I think there's other ways to classify it as well, but these are the 2 things that I wanted to raise so we can get our clinical features. Does that make sense?
Yep.
It does.
Good. Dan always looks like he has something to say.
Could you just recap the uncomplicated one?
Generally, they're healthy, non-pregnant, and premenopausal females.
Cool.
Generally.
Healthy young women.
Yeah, so they usually get UTIs more often, right? Various factors.
But why? Why do females get
Why, actually? So that moves on to our next part. Lovely. So using the first principles that we talked about now, what are the causes of these urinary tract infections?
Come on, Dan.
Using all the things that we did.
As in what predisposes females to urinary tract infections? A short urethra is one thing.
Shorter urethra. So that's an anatomical reason for why this happens, yeah? Good. But also, this urethra meatus, this opening, is actually closer to another structure.
Yes, the anus.
The anus.
Yes.
Good. And so the anus also has different types of bacteria which might colonize the urinary tract.
That's why they say never to wipe back to front.
That's correct.
Yes.
Yeah, right. Wipe front to back so then you don't mix this stuff up.
Cool.
Yeah, good. So that could be a good segue. What kind of bacteria lives in the digestive system that commonly infects us?
The one and only E. coli.
E. coli is the most, I was going to say popular, most common.
One and only. There's many different kinds of E. coli.
E. coli is one, but then there's another type of species as well. Just random other than E. coli.
Enterococcus.
Enterococcus, good. So that includes Faecalis, right? And then we also have Klebsiella. So these are like the 3 major bacterial species.
So could you repeat those, sorry, again?
E. coli is the biggest.
Yeah.
Can you pronounce the full name, JT? In fact, I want full
can't.
names for all of these.
No, I can't. No.
give it your best shot, JT.
Escherichia coli,
Yeah, good
which
job.
is 80%, and it's found in the GI tract.
Yeah.
Staphylococcus saprophyticus,
Perfect.
especially in sexually active females.
Yep.
And Klebsiella pneumoniae, which is also present in parts of the digestive tract.
Nice.
And also Enterococcus species. So these are the types of bacteria.
Nice.
Yeah, good. So Dan mentioned earlier about the anatomical reasons why they have the bacteria ascending, because they have a shorter urinary tract. Is there anything else? Something related to nosocomial reasons?
Going back to IDCs.
Yep, that's one of them.
catheters.
Yeah, so that's 80%, but there's other things too.
Or
What does...
every old man.
Yeah, what are they on?
But I was going to say benign
Medication.
prosthetic.
You mean
Medica-
medication.
Specific what type of medication?
Antibiotics.
Antibiotics, right? So then you kill the normal flora and then you get these
Good
opportunistic pathogens to come up.
Yes.
Good. Another category is like behavioral reasons. It's called honeymoon cystitis. Can you try to guess why, Jason?
Give it your best shot.
Yeah, Jason.
Sexual intercourse leads to bacteria going in the perivaginal region, which is near the urethra.
Good.
Can lead to a UTI.
Good. So what's the life pro tip for people who have sex frequently?
Oh, urinate after sexual intercourse.
Good. And what's that defense mechanism that we
You don't know.
You just said
You
it.
said it. You said it before.
I know that's a.
No. But why?
Come on,
why
derive
does,
the first
Why does
principles.
urination?
Oh, because you flush the urine out.
There you go.
Yeah,
you
yeah.
flush
So
the
you don't want
bacteria out by
urinary
urinating.
stasis.
Yeah.
He's thinking.
Yeah, good,
Yeah.
good. Okay, moving on to the clinical features. We have signs and symptoms.
Yeah.
So, as I alluded earlier, mainly we have the lower UTIs and the upper UTIs. So let's go first with the lower UTI. Where's the location of these lower UTIs that you usually get?
Bladder or lower.
Bladder. And where is that on the abdominal region?
So bladder pain typically has suprapubic.
Suprapubic. Yeah, that's what I want to say. Yeah. And then upper UTI, in contrast, where's that pain?
Flank pain.
Flank pain, good. And also the costovertebral angle, right? So these are the typical signs that you want to find on examination. What are the other symptoms that you might see for lower UTI? Actually, both of these will have it.
So with lower UTI, the most common symptom would probably be pain on urination or dysuria.
Dysuria, good. And why is that the case? Do you know the pathogenesis of it?
Well, I assume the bacteria damage the epithelial wall of the urinary tract, which can cause pain.
Yeah, and if it's a lower UTI, where is this usually?
Oh, in the urethra.
A little bit higher?
Meatus? Or,
Bladder?
The bladder.
Oh,
let's
the
just,
bladder.
Yeah, let's just stay with the bladder, right? So
Yeah.
then the bladder is inflamed, and then when you contract, that causes the discomfort. That's why you
Okay.
get pain.
Yeah.
Okay, using the same understanding, you get inflammation of the bladder. What other urinary symptoms will you get as well?
Symptoms?
Yeah, so you
Frequency?
get pain. Huh? Sorry?
Frequency.
Frequency, yeah, good. Frequency. And also another type,
Urgency?
urgency. And the pathogenesis of that is because of the bladder's inflamed, it gets smaller. There's a reduced capacity of the bladder.
Ah, yeah.
Okay. Sometimes with the lower UTIs, there's another thing that you might get. So the urinary tract or the bladder is irritated, is edematous, and you get a urinalysis.
So these are signs now you're talking about.
It's a sign, yeah.
Yeah.
Sign versus symptom, man.
Yeah.
It's a sign that you, it's a feature that you see now.
Hematuria.
Hematuria.
No.
Yeah.
Yeah.
Okay. So that's mainly the lower UTIs that we talked about. Okay.
Yeah.
So then I alluded to earlier, upper UTI is a bit more severe usually. Because of the inflammatory cascade, what other things do they usually present with?
Fever?
Fever, and then they sometimes might go like, ugh.
Vomiting? Nausea?
Yeah, nausea and vomiting. So that's roughly like how you delineate
They go
them. So then with the upper UTI, you also get those urinary symptoms that we described earlier, because I think rarely do you just get cystitis without getting pyelonephritis.
Do you mean the other way? Rarely do you get pyelonephritis without cystitis?
Yeah, from how I see it, it's just you have to ascend up, right?
Yeah, yeah.
So
As
you
in,
can't-
as in because you said the other way. So you
Okay,
mean
yeah,
rarely
yeah,
do you get
yeah.
pyelonephritis without
Yeah.
cystitis, yeah.
Yeah, although you can get it from like through the blood as well, so
Yeah.
you can infect the kidney
Yeah.
as well.
Okay.
But let's just keep it simple like that.
Mm-hmm.
Yeah. Now we talk about the management, and I guess then we'll also involve the investigations here.
Mm-hmm.
Actually, one thing to add after that, with elderly women,
Yep.
they may only just present with urinary incontinence, and
Yeah.
they don't have any other urinary symptoms.
Right, okay. So,
So sometimes they might even seem just confused on the ward. They're like a bit delirious. Exactly.
Yeah.
So you can't really tell unless you do all these investigations.
Okay.
Could you just say that for the vast majority of patients, you present with some sort of pain and or fever?
If it's an upper UTI
Yeah,
with the fever.
Okay,
Yeah.
for UTI.
Okay, cool. So then, say we've done the doctor's A, B, C, D, E, and then you see the patient come in and you do all this history stuff, right? So what are the things that you want to investigate at this point to help you figure out what's happening?
So starting off with a bedside investigation, would you do
Yeah.
a urinalysis?
Urinalysis. Okay, and so within that, let's then figure out what you will see within the urinalysis.
So any infection, you get leukocytes.
Leukocytes. And what does that tell you actually if it's raised?
So raised means that your body's creating like an immune response to the infection to kill the bacteria.
What is leukocyte esterase actually? It's an enzyme. What is it produced by?
I assume it's produced by white blood cells.
Yeah, that's correct. So when you have the inflammation, then you'll have these white blood cells. And that's why you get leukocyte raised or positive.
Yeah.
Good. Something else Dan talked about earlier was the nitrites. If nitrite is positive, what does that tell you?
It indicates that gram-negative bacteria are there.
Why is that? Do you know why? It's a gram-negative and not gram-positive?
I assume that the gram-negative bacteria can convert nitrates to nitrites.
That's correct.
Oh,
yeah,
okay.
that's
Yeah.
correct. Yeah.
What's an example of a gram-negative bacteria?
E. coli.
Oh,
The
E.
most
coli.
popular one.
Yeah.
Most common one.
Most popular. You know what?
You know, probably is most popular, let's be honest.
8 out of 10 people will choose E. coli.
Yeah, so gram-negative, the way I remember it is N for negative, converts nitrates to nitrites.
Sweet.
But if nitrite is negative, does that exclude a UTI?
Does not.
No, because gram-positives can still cause UTIs, such as Enterococcus species or Staphylococcus species, although E. coli is the most common. And then one thing I think we need to understand is what is the best method to collect this urine on urinalysis?
They should catch it midstream.
Midstream. Okay, typically then you get this urinalysis. You can also send it off. What
Yep.
do you send it off for?
Like a urine MCS?
Yeah, good. And why do you do that?
Because the MCS stands for microscopy, culture, and sensitivity. You want to see, with the MCS, you'll be able to tell what bacteria is being grown and what antibiotics are sensitive to it are sensitive to it or not.
Yeah, good. And that's about it. Are there any other additional investigations you might want to conduct?
Like a pregnancy test,
Right.
a beta HCG.
And what if they have abnormal vaginal discharge? What's something that you might want to do there?
Swab. Get a swab.
Yeah, and you want to test for the STIs.
Yeah.
But these are like those
Separate.
not general conditions, right?
Yeah.
How about during imaging of the urinary tract? Is that common, do you think?
Not in an uncomplicated UTI, I wouldn't think.
Yeah, generally not.
Yeah.
Because
You could.
yeah.
You do an ultrasound.
And what would you want to do there? Why?
You could ultrasound the bladder. You
Mm.
see if there's any signs of urinary retention.
Yeah.
You could ultrasound the renal tracts
Mm.
to see if there's any evidence of hydronephrosis
Yep.
or
Yeah.
obstruction, perhaps.
Yeah. Good.
That
So
seems a bit
generally, if there's
overkill, though.
uncomplicated or lower UTIs,
You
you
would.
generally
Okay.
wouldn't
Yeah, you
do
would
it
do it.
unless you want to exclude other complicating factors like what Aiden was mentioning earlier. Yeah, good.
Mm.
So I actually want to backtrack there. Urinalysis is the best test for all patients, the initial test, except for females with those typical symptoms. So uncomplicated UTIs, you generally don't even need to do the urinalysis.
Really? Even though it takes like 30 seconds
Because
to do.
generally you don't. Well, you can, but then typically you don't because you treat them with the empirical antibiotics.
Okay.
So
It's only if they don't recover with the empirical antibiotics, then you want to do the urinalysis in urine culture because then you want to target them a bit more specifically to
Yeah.
the bacteria. Good. So you've done the investigations there. What else left with the management? We have already mentioned the antibiotics. 2 more things that you would do, and that's pretty much it.
Dan's
Uncomplicated
favourite.
UTIs is quite
Dan,
simple.
You know what it is.
You know what it
You
is.
know
The
what it
2
is.
words.
You know.
You
what it
know.
is. You know.
Patient education.
That's right.
We love to hear it.
Yeah.
Yeah. So what would you educate about patient education? There's 2 life pro tips we already mentioned earlier. Jason?
So urinating after sexual intercourse.
Good. But in generally, you should void your bladder frequently.
Yeah. You shouldn't hold on to it. if
Yes,
possible. Yeah.
yes. Well, the things which you mentioned in patient education. It's quite general, really.
Make sure you drink enough water.
Yeah, okay.
I've heard
As in diet, exercise, all that.
I don't even know
I
that
have no
helps
idea.
diet
Don't-
I've
exercise.
heard
smoke,
cranberry juice is
Yes,
Yeah.
there's a lot of
UTIs.
Yeah.
tales
Yeah.
out there.
I don't think I think there is maybe some
Actual evidence?
because I think the cranberry juice helps with the acidity of the urine.
Okay.
That's the
Acidifies the urine a bit.
acidifies the urine.
Okay. Yeah.
I
Where's
mean,
your
I've heard
evidence?
that.
hey?
But generally those things, it's just pee often and have good hygiene, you know, in that
And good
sense.
hydration.
You're on urology right now, Dan.
Hmm.
Can you ask your team if cranberry juice does
Yeah,
this?
yeah, okay. Yeah, I'll let you know.
One of the
Next time.
internal medicine,
But they wouldn't
physicians-
show to us, right? Although these would be the complicated UTIs.
No, I mean, you
No, no,
If
just
they're
the
in urology.
cranberry juice
yeah,
itself. I'll
just ask
yeah.
like,
Oh, okay, yeah,
Yeah,
I guess you
that
can do
helps.
that
like a
too.
specialist.
Yeah.
I'm pretty sure it's because it apparently acidifies the urine. But anyway,
Good. So then we've done patient education, antibiotics, and what's something else that you might just want to do if they're in pain as well?
Analgesia.
Yeah, so
Perhaps.
just some supportive treatment while they're there.
Mhm.
So this is the management for uncomplicated UTIs. Just
Yeah.
wanted to keep it simple like that.
Yeah.
But if it's complicated, then the choice of antibiotics that you choose depends on the extent of infection, like how much, if they have the fever and nausea, they might even have acute kidney injury, right?
Yeah.
So that might be all different. And also it depends on the locality in which you're at, the local pathogens which exist, and that directs your empirical antibiotics, and then also the sensitivity and resistance patterns.
so
Yeah.
just so I can never remember antibiotics. Like, what are the more common empirical antibiotics you give for UTIs or uncomplicated ones?
Right.
It's nitrofurantoin and trimethoprim
Hmm.
are 2 commonly used ones.
Yes, that's right.
Yeah.
So that's basically it. Dan, why don't you repeat the 5-step process for the management? Actually, the first step I didn't really tell you, but it's to, like, doctor's ABCD, you want to assess the
yeah.
symptom severity.
Hmm.
Okay, so Dan, why don't you repeat the 5-step management for
So,
UTIs?
so you've got a patient, you do an A3E assessment,
Mm.
and if they're hemodynamically stable, you can take a thorough history, then you can do an examination, perform investigations. Primarily, you're doing an urinalysis, looking for nitrites, raised leukocytes, and microscopic hematuria. Following this, if you diagnose an uncomplicated UTI, you can start, obviously, management, where you can what was it again? Patient education on, ensuring frequent urination, especially after sex. Give them empirical antibiotics. So I think we said trimethoprim and, what was the last one?
They're in pain. Help me.
Oh, they're analgesia. Yeah, of course.
They're in pain, help me.
Give them
Just some supportive
some
treatment.
paracetamol.
Yeah, pretty much it.
Okay, I'm going to flip it back to you, JT, now. My name's Jeanette. I'm a young 25-year-old female coming into your GP practice because I'm complaining about pain on urination. Okay, you've done a urinalysis and it's pretty pathognomonic of a UTI. What you going to do?
Well, Jeanette, thank you for coming in today. I'd love to help you with your problems. So what we see here is that you have a UTI, and it seems to be a lower UTI. So it's somewhere in your bladder or your urethra. And so what I want to help you today is help you with your pain. If you're feeling any pain, I'm going to give you some Panadol to help you with the pain down there. And then the second thing is I want to help you with your infection. So I'm going to give you some typical antibiotics for you to use. And hopefully that will help cure your UTIs. Now, the last thing that I want to do is teach you about UTIs so this thing doesn't happen again. Because obviously you seem to be in a lot of pain. And I don't want that to happen to you. So just to check, I want to make sure that you're drinking enough water and you're going to the bathroom frequently, because you want the urine to keep flowing so that bacteria doesn't stay in your urinary tract. Because when it stays there, that's not good. Okay? Now, I understand that you're also sexually active, so it's very good to always go to the bathroom after you have sex to make sure that the bacteria doesn't stay there and you can clean it out. Now, the third thing is if you go to the bathroom, take a number 2, to wipe front to back and not back to front, because we don't want that bacteria in your digestive tract to get transferred into your vagina, because that's another method, what gives you UTIs. So all in all, drink a lot of water, have good hygiene in general, and come back in a week's time after all these antibiotics that you take, and if you're in any pain, come back in the meantime, but otherwise I think you'll be okay.
Thank you, Jay. That's
good.
very smooth.
good. Anyway,
Good job.
Good.
Nice.
Yeah.
So before we wrap it up, I'm just going to give you 3 key takeaways that you can take away for this UTI episode.
Yep.
So first, UTIs occur when there is an imbalance in the host defense mechanism and the bacteria's infection mechanism. Number 2, bacteria causes acute inflammation of the urinary tracts, resulting in the typical UTI symptoms of urinary frequency, urinary urgency, and dysuria. And finally, urinalysis and antibiotic treatment is recommended for all patients with symptomatic UTI. That's the 3 key takeaways. And that is our 10th episode of 1 p.m. Thank you everyone for tuning in. If you have any questions or comments about the next episode, we'd love to have you. We hope to see you next time. Symptom-free. Bye-bye.
Assuming everyone with UTI listen to it. Thank you, JT. Okay, anyway.
Hi guys, it's JT here with a bit of a fact check. For these first principles, we focused on the treatment of uncomplicated, symptomatic, non-recurrent lower UTIs. There are different principles for recurrent and symptomatic UTIs. Now, generally, you don't have to treat asymptomatic UTIs unless, number 1, they are pregnant, or 2, they are awaiting a urological procedure. Further on in the episode, Jason talked about cranberry juice and the prevention of UTIs. There is conflicting evidence on cranberry juice for preventing UTIs. According to the American Urological Association guidelines, cranberry juice can be used for prevention as there is little risk associated with these supplements. The bottom line, cranberry won't hurt, but it may help. It could be worth trying if you struggle with frequent UTIs, as the risk in doing so is very low. That's it for the fact check. Thanks guys. See you at 1 p.m.
Thanks so much, guys, for listening to this week's episode of 1 p.m. If you want some more resources, please check out our Anki flashcards or our Notion documents, where you can find some links to other episodes.